Hey there. If you or someone you care about is dealing with a melanoma diagnosis, you absolutely know that feeling of wanting to do everything you can to help your treatment. So today, we're going to look at some really compelling new research that's asking a powerful question. What else, beyond the standard care, could actually make a difference?
Right. This is the big question, isn't it? You're doing everything your medical team tells you to do, but it's totally natural to wonder, what else is out there? What's the latest data showing us about other things that might support the journey? So let's dive in and see what the research has been uncovering.
Okay, and right up front, we have to be completely 100% clear about this. Think of this explainer as a guide, a tool to arm you with information and some really good questions. The whole point is to help you have a better, more collaborative talk with your oncologist. It is absolutely not, under any circumstances, a substitute for professional medical advice. All right, with that crucial point out of the way, let's get to the good stuff, the research itself. We're going to spotlight 3 really interesting findings that have popped up from recent analyses of patient data. You can think of these as potential new allies on this treatment journey.
So where are these insights coming from? Well, they come from what are called observational studies. Basically, researchers looked at huge groups of patient records to see if they could find any patterns or connections. They were specifically looking for things that were linked with better responses to immunotherapy. You know, the treatment that gets your own immune system fired up to fight cancer.
First up is something you might not expect at all: dietary fiber. Yeah, fiber. It turns out that what's going on inside your gut could have a massive impact on how your body actually responds to your treatment.
So why the gut? Well, it's home to your microbiome. That's this giant community of trillions of bacteria that, believe it or not, basically trains and manages your entire immune system. For immunotherapy to really do its job, your immune system needs to be in fighting shape, and it looks like the microbiome is a huge piece of that puzzle.
And check this out. This is what the research found. In one study, patients who said they ate a high-fiber diet had more than double the response rate to their immunotherapy. Let me say that again. More than double the response compared to people with low-fiber diets. I mean, that is a staggering difference.
And it wasn't just about that first response either. That same high-fiber diet was linked to a 41% increase in progression-free survival. But here's the really crucial part. The researchers noticed this benefit was strongest in patients who were eating a lot of fiber but were not taking any commercial probiotics. This suggests that the real magic might be in feeding your own unique gut bacteria.
So we've seen how diet can play a role. But our second finding, wow, this one comes from a place you would probably never guess. The allergy aisle at the pharmacy. It seems there's a really unexpected link between common antihistamines and melanoma treatment.
Specifically, these studies found a connection between patients taking what are called H1 class antihistamines. We're talking about things like loratadine and better survival rates. So what's the thinking here? Well, histamine, the thing that makes you sneeze during allergy season, can actually create a kind of protective shield around the tumor. These antihistamines might help break down that shield, which lets the immunotherapy get in there and do its job.
And this chart really paints a picture of what's going on. When they looked at patients with naturally low levels of histamine in their blood, their response rate to treatment was 3 times higher than those with high levels. 3 times. That's a pretty strong clue that histamine is a key player here.
And just to put one more number on it, some of these analyses showed that overall risk was reduced by over 50% for melanoma patients who were taking these specific antihistamines. Again, this is a really compelling piece of information to bring up with your doctor.
Okay, for our third and final point, let's turn to one of the most common medicines on the planet, aspirin. It seems like its job might go way beyond just headaches and pain, especially when we're talking about cancer treatment.
And we're not talking about a small study here. One huge analysis looked at the records of over 2,400 melanoma patients who were all undergoing immunotherapy. They were just looking for patterns, trying to see if any other medications made a difference, and aspirin just jumped off the page.
The results are pretty dramatic. You can see here, the group of patients not taking aspirin had a median progression-free survival of about 6.5 months. But look at the group that was taking low-dose aspirin. That number leaped to over 15 months. That is more than double the time. Just incredible.
And even when they adjusted for all sorts of other things like age or overall health, that connection was still there. They found that patients on low-dose aspirin had a 33% reduced risk of their disease getting worse. The theory is pretty straightforward. Aspirin reduces low-grade inflammation, and that might help create a less friendly environment for the cancer, giving the immunotherapy a better shot.
So we've talked about fiber, antihistamines, and aspirin. They seem like three totally random things, right? But they all point to one really powerful idea. Let's tie it all together.
The common thread running through all of this is the idea of tweaking your body's own internal environment. Whether you're feeding your gut microbiome to get your immune system in shape, or maybe lowering histamine levels to expose the tumor, or reducing inflammation, all these strategies seem to help create conditions where the standard treatments can just work better.
So, if you're taking notes for that doctor's appointment, here are the key takeaways. A high-fiber diet seems to be a huge support for that gut microbiome, which is critical for your immune response. Certain H1 antihistamines are linked to changing the immune environment right around the tumor. And finally, low-dose aspirin is associated with controlling inflammation, which may also give immunotherapy a boost.
And this brings us right back to the most important thing we've said today. The reason we're sharing all this is not to give you a new to-do list. It's to empower you. The whole goal is to help you have a really proactive, informed, and engaged conversation with the person leading your care team, your oncologist. Think of these findings as tools for that conversation. They're starting points for questions that are tailored specifically to you and your situation. So the real question we want to leave you with is this. Based on everything we've just talked about, what new questions are you going to bring to your healthcare team? Thanks for joining us.